everyone for joining us. My name is Jonathan Modi with the Oregon Health Authority External Relations Division. This is a media briefing to provide an update on the 2023-2024 respiratory virus season. I have a couple of infectious disease experts here who will provide you an update on the season and what's to come, and talk about vaccines and some other prevention measures. We will take one question at a time. If you'd like to ask follow-up questions, we will take those when everyone has had a chance to ask a question. We ask just that you mute your audio and use the raise your hand function if you'd like to be added to the queue to ask a question. Please include your media affiliation so we know that you are with the media. If you don't include your media affiliation, you won't be let in, unfortunately, and you'll need to join the YouTube live stream where you won't be able to ask a question. So please include your media affiliation if you haven't already. Yes, and again, if you're not with the media, use the YouTube live stream at the link included with the advisory for this briefing. Also, we will grant permission to record this briefing one by one. So again, if you want to record, let us know. It does take a little bit of time, so we appreciate your patience after you ask us for permission to do that. If you have audio issues and can't ask a question, feel free to drop it in the chat, and I'm more than happy to ask it on your behalf. For the benefit of our ASL interpreters and also our Spanish interpreter, I ask that all reporters and our speakers to please speak as slowly as you can. Also, a recording of this media briefing will be at the YouTube link shared in the advisory for this briefing. So in other words, the live stream link on YouTube will become the recording. So check that out. With that, I will kick it over to Dr. Paul Cieslak.
Hi, good morning. I'm Dr. Paul Cieslak, Medical Director for Communicable Diseases and Immunizations at the Oregon Health Authority. Thank you all for coming. I'm joined today by a colleague from Kaiser Permanente Northwest, Dr. Katie Scharf, who is Chief of Infectious Disease there. We will touch on what's expected during the 2023-24 respiratory virus season, recent developments in the world of vaccines, some new guidance OHA is sharing with healthcare providers, what people can do to protect themselves and those around them from COVID-19, influenza, and respiratory syncytial virus, or RSV, and we will answer your questions during the Q&A portion of this media briefing. Some of you might recall a similar news conference we held early last December, when State Health Officer Dr. Dean Seidlinger was joined by clinician partners from OHSU, Providence, and Legacy to ask Oregonians for their help in managing a surge in respiratory viruses that overwhelmed our hospitals. The surge triggered an emergency declaration from Oregon's governor and forced some hospitals to initiate crisis standards of care so they could adjust patient care practices to ease their significant staff capacity issues. At this point, with continued transmission, but widespread partial immunity from vaccination and previous infection, COVID-19 is endemic. We're in a different place. In May, we saw the ending of the federal public health emergency, which led to our lifting remaining mask and vaccination requirements. We updated guidance that had recommended 5-day isolation after COVID-19 infection to advise staying home until fever-free for 24 hours and symptoms were improving, avoiding contact with those at high risk for severe illness, and considering masking for 10 days. And we changed how we monitor and report COVID-19 to mirror how we've done it for influenza. While transmission of COVID-19 continued, according to our wastewater surveillance data, hospitalizations and COVID test positivity dropped significantly over the summer. In addition, influenza and RSV activity eventually waned, as it does every spring, following a late winter peak. But the potential for another respiratory surge that swamps our hospitals and healthcare system still exists. Even before COVID-19, influenza and RSV could overwhelm hospitals in some regions of the state. COVID-19 has been putting many more people in the hospital than influenza and RSV. So we have to expect that surges in respiratory virus hospitalizations will be worse. Straining of hospital capacity will be an issue nationwide, and perhaps more so in Oregon, where we're additionally challenged by the fact that we have relatively few hospital beds per capita. Since the end of May, though, we have seen a steady increase in COVID-19 test positivity. It's gone from a low of 4.3% on May 27th to around 15% by September 16th. We've also seen the number of patients hospitalized with COVID-19 in Oregon double, from 106 on June 21st to 219 on September 19th. And although influenza and RSV activity remains low, we do expect it to go up as usual during the fall, with students back in school and people heading indoors to escape colder temperatures and the rain and to gather during the holidays. Vaccination is the best way to protect yourself against infection and hospitalization by respiratory viruses. Last week, CDC's Advisory Committee on Immunization Practices, ACIP, voted to recommend updated COVID-19 vaccines for the 2023-2024 respiratory virus season. They are designed to protect against the XBB sublineages of the Omicron variant, which account for more than 95% of the circulating virus variants in the United States. CDC recommends that everyone 6 months and older get the updated COVID-19 vaccines to protect against the potentially serious outcomes of COVID-19 this fall and winter, including hospitalization and death. COVID-19 vaccines also reduce the chance of having long COVID. Many factors affect the exact timing of the vaccine's arrival in Oregon and the rest of the country, but we expect healthcare providers and pharmacies to begin scheduling COVID shots over the next several weeks. It's important to remember that a major goal of vaccination is to broaden immunity, even if vaccine formulations do not perfectly match currently circulating viruses. That's why each year we still have highly recommended the influenza vaccine, even as its effectiveness has hovered around 50%. Plus, if you've had the flu shot, you're less likely to have severe influenza and be hospitalized. On the RSV front, a new RSV monoclonal antibody immunization for babies and toddlers called nirsevimab is expected to be available commercially and to healthcare providers enrolled in the Vaccines for Children, the VFC program, later this fall. We're watching RSV activity closely and will communicate to local public health and healthcare partners as we see an uptick prior to season onset to guide nirsevimab administration for infants. A new RSV vaccine for adults 60 and older has been available on the commercial market for several weeks. So people should check with their insurance plan to make sure RSV vaccination is covered. CDC has not announced a timeline for when the new vaccines will arrive in state-sponsored vaccine programs, such as Oregon's Vaccine Access Program, which provides free vaccines to eligible children and adults. Insurance plans will cover the COVID-19 and influenza vaccines when they are available. The Affordable Care Act requires insurers to cover most ACIP recommended vaccines without cost sharing, such as copays or deductibles. People could get the COVID-19 and influenza vaccines by contacting their health plan, healthcare provider, county public health clinic, or federally qualified health center, FQHC. They can also search for a clinic by zip code by visiting vaccinefinder.org or by calling 211 or visiting 211info.org. Remember that there are antiviral treatments for influenza and for COVID-19. People at high risk should plan to get tested and, if positive, to start antiviral therapy promptly should they develop respiratory illness. Finally, a few updates about masks. Throughout the pandemic, community use of masks was one of several non-pharmaceutical interventions that together slowed the spread of SARS-CoV-2, the virus that causes COVID-19. We believe COVID-19 transmission would have been much higher had these interventions not been undertaken. On April 3rd of this year, after Oregon met several criteria that indicated decreased impact of COVID-19 in the state, OHA lifted Oregon Administrative Rule 333-019-1011, which required mask use in healthcare settings. OHA has no plans to reinstate that rule. However, for the 2023-24 respiratory virus season, the agency is strongly recommending masking in healthcare settings, caring for patients at highest risk for severe disease and hospitalization. This is not new guidance, but from existing OHA guidance that was published in April, and it remains relevant and important for this respiratory illness season. We're also recommending continue masking in healthcare settings for people who are unvaccinated, those with compromised immune systems, with underlying health conditions, who are 65 and older, and who live with others at high risk of severe disease. Thank you. I will now pass the mic over to Dr. Scharf so she can present her remarks.
Great. Can you hear me okay?
I can hear you.
Great, thanks. I want to say thank you to Dr. Cieslak and thank you for having me here today. First of all, just to start off, I appreciate Dr. Cieslak's thorough summary, and we'll try and keep my remarks brief and just highlight salient thoughts. I just want to echo what Dr. Cieslak mentioned on the importance of taking respiratory viral season very seriously. If we see even a small surge in flu, COVID, RSV, or the three viruses at the same time, that could overwhelm an already very stretched healthcare system. But along those lines, we actually have important tools that are available to protect ourselves, our family members, and our community against these respiratory viruses with, as Dr. Cieslak mentioned, new vaccines and new products for RSV. And so I just wanted to briefly highlight some important features about each of these vaccines. Just to start with flu vaccine, I think as a community, we underestimate the significance of influenza virus. And to remind individuals that last year it's estimated that flu was responsible for 58,000 flu-related deaths in the United States. The flu vaccine is updated each season, and so it's important to get an updated vaccine for everyone aged 6 months and older. But despite that, last year, only about 50% of Oregonians chose to get the flu vaccine. So just want to urge every eligible person to get an updated flu shot this season and every season. And then moving on to the COVID vaccine, I guess just to educate that the COVID vaccine this season is not necessarily considered a booster because it's a completely reformulated strain to protect against the current circulating variants. And really the importance of the COVID-19 vaccine is to prevent severe disease and hospitalization. And so we really need to focus our efforts on vaccinating those individuals who are highest risk for severe disease and hospitalization. That includes elderly individuals, immunocompromised patients, patients with chronic medical conditions, and then pregnant women. And then moving on to RSV. So RSV stands for respiratory syncytial virus, which is considered a seasonal virus, usually peaking late fall to early spring. And RSV causes significant burden in the extremes of age. So in the elderly, it caused up to 100,000 hospitalizations in the United States last year. and it's the leading cause of hospitalizations for infants in the United States. But this year we actually have multiple new products. It's really a groundbreaking year for RSV to protect against infection. So for individuals 60 and older, there are vaccines to protect against RSV infection. There's also a RSV vaccine that's available for pregnant individuals in their third trimester. And finally, as Dr. Cieslak reviewed, there's a new monoclonal antibody called nirsevimab that's available to infants in their first RSV season to protect against infection. Just to give you a framework here at Kaiser Permanente, we are already administering influenza vaccines, anticipate having COVID vaccines available as early as next week, and then anticipate RSV vaccines as well as the monoclonal antibody product, nirsevimab, for infants shortly thereafter. One question I always get, both from friends, family, and other clinicians, is what kind of respiratory season it's going to be. Like, predict what kind of flu season we're going to have, and I wish I could say with any sort of certainty what kind of respiratory season we will have. But just to give you some framework, we often look to the Southern Hemisphere for our influenza season, because flu is considered a seasonal virus. And this year, the Southern Hemisphere had somewhat of an early flu season that appeared to impact unvaccinated children. So although I can't say with certainty that will be what we have here, but that is somewhat of a bellwether for us here in Oregon. And then I think the pattern of COVID is still uncertain. We're not quite sure if COVID is considered a seasonal virus, as we see surges in both summer and winter months. But I think the important thing is that if we see an increase in all three viruses at the same time, that is when we could potentially see a crushing our currently strained healthcare system. So I guess in closing, I just want to say, as a physician, as a parent, as a community member, it is so discouraging to see our healthcare system become overwhelmed during respiratory viral season. And that leads to delays in care, it leads to canceled surgeries, it leads to long wait times in clinics and emergency rooms. And so I really urge all Oregonians to consider the tools available to them to prevent respiratory infection this season. Thank you.
Thank you, Dr. Scharf, and thank you, Dr. Cieslak. We'll now move to questions. A reminder to please use the raise your hand function if you'd like to be added to the queue to ask a question. Also, please make sure to mute your audio if you're not asking a question or you're done asking a question. And also, a final reminder about our interpreters, our ASL and Spanish interpreters, if you could try to speak slowly when asking a question or making a comment. So again, if you want to ask a question, please use the raise your hand function, and we will, one of our physicians here will answer your questions. And once again, I will take questions in the chat if you'd like me to ask a question on your behalf. Well, I guess we covered it all. Please let me know. We'll give it one more minute and let me know if you'd like to ask a question of our two physicians here. And to Britt, if you see a question that I missed somehow, please let me know. I will just provide one reminder. If you do have a follow-up question that I can direct to Dr. Cieslak, after this news conference, or to Dr. Scharf through Karen, who is Kaiser's PIO. You can send me an email to phd.communications@oha.oregon.gov. We'll just wait one other minute here, see if there are any questions.
Possible that the system's not working?
Yeah, I just check with Britt here, make sure all systems are still go. Okay. All right. Well, I'm not seeing any questions in the chat. Once again, feel free to send me any questions that I can direct to Karen at Kaiser, for Dr. Scharf, and I can certainly direct any questions to Dr. Cieslak that you have after this news conference. A reminder that this availability will be available at the YouTube link as a recorded stream once we are complete here. So with that, I will close out this meeting, and want to just thank Dr. Cieslak and Dr. Scharf for the great information, for joining us today. And please let me know if you have any other questions. And have a great rest of the day.
Thank you all.
Take care, everyone.
Thanks.